So what is exercise and why do we do it? So when we refer to exercise, it can really be a variety of activities that we partake in. So from a definition perspective, exercise is an activity requiring physical effort carried out to sustain or improve health and fitness. So this can be from activities such as yoga, weightlifting, soccer, walking, gardening, any kind of activity that requires effort. The current Canadian recommendations are for about 150 minutes of exercise per week. And this is in that 150 minutes, it's included moderate, vigorous, and bone and muscle strengthening activities. And I'll describe what those are on the next slide. So when we refer to the 150 minutes of activities that are exercise that we should be getting per week, it should be a combination of moderate, vigorous, and strengthening exercises. So moderate exercise is the exercise that makes you breathe harder and your heart beat faster. However, for this type of exercise, you should be able to talk but not sing. So some examples of this might include walking quite quickly, skating, bike riding, things where you can feel your body working, but not so much that you're out of breath. Vigorous activity are ones that make your heart rate increase quite a bit. So these are the ones where it might be harder to catch your breath or harder to have a conversation. So it's just like running, basketball, soccer, cross-country skiing. And then we should also be including strengthening activities. And this is both muscle strengthening and bone strengthening activities. This is muscle strengthening activities are ones like push-ups, sit-ups, weightlifting, things that really focus on building your muscle. Where the bone strengthening activities are more that have a push-pull on your bone. And these really help increase the integrity of your bone, which is especially important as you age. And some of these activities are walking, yoga, or running that have an impact on your bone. So when you think about that exercise and your goals for the overall week, you want to be including a combination of all these types of activities for the best overall health. Health Canada has really tried to switch and think about health or activity in a 24-hour timeline, because even if you think, oh, I'm healthy, I exercise for my 150 minutes per week or my 2.5 hours, if the rest of the time you're sitting on the couch or if you're, not really moving, in general, that's not really a healthy way to live. So what they've tried to do is really break it down into 24-hour recommendations, and within that 24-hour period, you should be integrating your physical activity, your sedentary time, as well as your sleep. And some of the guidelines or goals that they have, for instance, for your sedentary time, having no more than 3 hours of screen time per day, for instance, breaking up your periods of sitting as much as possible. What's really interesting here is things like Apple Watches or Fitbits. They'll actually remind you or stimulate you if you've been sitting for too long. So within that physical activity, you're seeing the 3 different types that you want to target. You're thinking about your sedentary time, ensuring you're not sitting for too long of a period overall over the day, and then also ensuring you're getting your consistent sleep. So that makes up an overall healthy kind of like 24-hour period. So I included this here because I think it's really something to think about. And this comes from Hippocrates, which is, most of us think of him as being the ancient Greek physician, the founder of medicine. And he says, and he was quoted to say, if we could give every individual the right amount of nourishment and exercise, not too little and not too much, we would have found the safest way to health. There was also a really interesting large review study that was published in the Journal of Obesity in 2009 that stated, or that they reminded us that while exercise is a treatment to prevent many chronic diseases, it is the lack of regular exercise or physical inactivity that is actually one of the causes of many of diseases. So it's really something to think about, is that, exercise not only prevents, but the lack of exercise can actually be a cause of disease. So there's so many benefits to something that, we can do for ourselves and we're in control of. So what are the benefits of exercise? And there are quite a few. So we're going to talk a bit about those now. So first, prevents and manages chronic health conditions. So there's actually robust literature to support this. Exercise has a large impact on chronic disease, cancer, diabetes, and heart disease significantly. Exercise improves your insulin sensitivity and cardiovascular fitness, reduces blood sugar, as well as the risk factors for metabolic syndrome. Those including increased blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol and triglyceride levels. So like I said, this is robustly supported in the literature. It can help you fall asleep and stay asleep. So exercise helps relieve anxiety and stress, and we'll talk about that a little bit more, but those can negatively impact your sleep. In addition, if you're exercising outside, you're exposed to natural light, which provides input into your sleep-wake cycle. It also increases your drive for sleep. It's important to note that some people do find that if you exercise too close to bedtime, that it can be disruptive to sleep as your body has a hard time relaxing. But overall, it can significantly improve your sleep. It can help your brain health and memory. So regular physical activity is especially important as you age. Combined with oxidative stress and inflammation, these promote changes in your brain structure and function. Exercise specifically has been shown to cause the hippocampus, which is part of your brain that's vital for memory and learning, to grow in size, which may help improve your mental function, especially in older adults. And lastly, there's actually literature to support that exercise has been shown to reduce changes in the brain that contribute to conditions like Alzheimer's disease and dementia. Build muscles and bones and prevent osteoporosis. So as you age, you lose muscle mass and bone mass. And bone loss occurs when there's an imbalance in the bone formation and resorption. So instead of your bones kind of, constantly in this kind of symbiotic relationship of being broken down and then being rebuilt, you're being broken down faster than you're being rebuilt. However, exercise has been shown to impact this positively. So as you age, the oxidative stress negatively affects bone remodeling, and exercise can positively affect that bone metabolism, stimulating bone remodeling. For exercise to really improve bone health, it needs to be in weight-bearing activities. So things like walking, running, where you're having a bit of the pounding type of activities through your bone, that stimulates that symbiotic relationship of bone degradation, but followed by formation. All right, then it improves mood and boosts endorphins. So really interesting, there's a large systematic review and meta-analysis that was published in JAMA Psychiatry just in April of this year. And this was a very highly talked about review article, because what they found is that the associations between physical activity and depression suggest significant mental health benefits from physical activity, even at levels below the public health recommendations. So even if you're thinking, I'm not meeting those 150 minutes, but say you can get out for an hour or an hour and a half overall throughout the week, that has been shown to actually significantly impact your overall mood, and it also boosts endorphins. So there is some real robust literature here to support that as well. I think especially in the current climate we are, where mental health is, on the forefront, and, with the COVID pandemic, everyone is feeling excess stress. Something as simple as getting out for that walk can really have a positive impact on mood and coping mechanisms. Assists in maintaining a healthy weight. So it's certainly part of a healthy lifestyle, which can help, maintain a healthy weight. But the literature does kind of support that it's not exercise alone. So it's part of a way to maintain healthy weight, but it needs to be part of an overall healthy lifestyle. So just some food for thought. So, when I do presentations like this, or when I'm listening to literature or reading about literature supporting exercise, it's pretty amazing the effect that exercise has on our bodies and in every realm, right? Not only just on how we're feeling, on our sleep, on our mental health, on our body composition, on our, risk for Alzheimer's and our memory. So there's so much literature to do this. It's really something we need to think about, and something that we can, and try to incorporate into our lives to help us maintain a healthy lifestyle. Okay, so we're going to shift a little bit now to talk about the menstrual cycle. I will preface this by saying I'm by no means an endocrinologist. I'm not a gynecologist, so I'm not an expert in hormones in the menstrual cycle, but I wanted to go over this on a very basic level so that we can understand what happens to our hormones during our menstrual cycle, so that we can then refer those hormones and think about how those hormones perhaps affect our ability to exercise or our ability to recover. Okay. So let me just see here. So the first 2 weeks of your cycle, so day one being the first day of your period, okay? So as you can see here, you have your hormone levels up along the x-axis, and then you have along the y-axis the days of your period. So day one being the first day of your period, and they're using here as a very average period. I know this can vary. There's certainly norms that are less and more than this amount of days, but this is just for an example perspective. So day 1 being the first day of your period, and day 28 being the last day of your period. The first 14 days, the first 2 weeks of your period being the follicular phase, with the second 2 weeks being the luteal phase. In this, and again, for really simplifying the explanation, there's really just focusing on the 2 hormones here, estrogen and progesterone, with estrogen being the lighter blue color that you see peak in the follicular phase, with progesterone really peaking towards the second half of your cycle, with estrogen falling. So during the follicular phase, which is the first 2 weeks of your cycle, estrogen is really dominant. This is a time where women tend to feel their best, and I'll get into a little bit more details on that in the next slide. But as you can see from day 1, your estrogen and progesterone are low, but over that period of your follicular phase, progesterone is staying low. However, estrogen is starting to peak, and it peaks up towards ovulation. Ovulation being approximately day 14, and that you can see a really big fall in your estrogen levels, with your progesterone starting to take over there. There is this second little kind of rise in estrogen with a further fall there towards the end of the luteal phase. And that's when, if you think about that second half of the luteal phase being when women might consider or be experiencing PMS, was when that estrogen and progesterone are both starting to fall again. So estrogen, in the literature and how it's really regarded for women is that estrogen influences positive mood, thinking, perception, motivation, appetite, anxiety, and our response to stress. So having plenty of estrogen help us feel relaxed, comfortable, and overall well. Energy and patience tend to be high when our estrogen levels are higher, craving adventure, new experiences. You tend to be braver, more confident, ready for challenge, think quickly, and learn new facts. And then when in the second half of your cycle, when progesterone is dominant, people or women tend to feel slower, and a little more quiet and more cautious, a bit more foggy, physically fatigued. It's more of a sedating hormone than estrogen. You may crave comfort food, have an increased appetite, more constipation, as well as water retention. So this is obviously very generalized, but if you're looking at it from just an estrogen and progesterone perspective, those first 2 weeks of your cycle are when women tend to feel their best, right? Clearer thinking, higher motivation. You're just really feel like you can conquer the world. And there is new literature, and there's a real focus now kind of coming to women's health and in the terms of how our hormones affect our behavior and our performance. And there is new focus on thinking about even planning your days or events where you may have, presentations or things when you need to be more on during the time when estrogen is more dominant, as you might feel that you are just at your best. Again, this is very generalized, and it's just the 2 hormones, as there are more hormones that do affect your menstrual cycle, but I was going to focus on these as with and how they affect performance. So if we think about that, and just in the simplistic way I described it, if we listen to our body during the first 2 weeks of your cycle, and we're thinking about it from a hormonal perspective, during those first 2 weeks, you're going to be wanting to do more intense exercise, ones that are, higher energy, more of the running, the plyometrics, the things that require a lot of activity and a lot of energy. During the second half of the phases, when you're going to want to be doing more of the quieter activities, you may feel more like just going for a walk versus a run, more doing yoga, things that are just calming to the body as opposed to really heightening the body. So if you actually get into the literature and find out, how does the hormones actually affect our exercise performance and our recovery? It's really interesting is the literature, it is pretty sparse when we're really looking at the effect of hormones on performance. So this one study I found, which I found really interesting. So this took place in 2020 and was published in the Journal of Sports Medicine. And what they found is that the exercise performance may be trivially reduced during the early follicular phase of the menstrual cycle. So this can be thought about in maybe when you first start your period, for instance. So due to the trivial effect size, the large between study variation, and the number of poor quality studies, the general guidelines are that exercise performance across the menstrual cycle cannot be formed. Sorry, I'm just getting a pop-up here. And they're instead saying that it really should be a individualized response to exercise performance, so that every woman at this point, we don't have research to support and to say exactly how our hormones actually affect our performance. However, it should be an individualized approach. So what I think here is it's really important to get to know your body. It's important to get to know how your hormones affect your cycle and how you feel during that. So having said that, I like to encourage perhaps people who are interested to know more about how their bodies may be affected by their hormones, or how their recovery or sleep or all aspects of life really are affected by potentially menstrual cycle, is to track it, right? So if you start tracking things over cycles, you may start to see patterns. You might see, for instance, oh, it's true during, my first 2 weeks, day 1 to 12, perhaps, did feel really energetic. I was more up for exercising at higher intensities. And then towards the latter half of your cycle, you may find that you are reaching for more of those quieter type of activities that don't require as much energy. Everybody will be different. And as we can see, that the literature doesn't really support one way or the other about how it might affect your performance. But it'd be interesting to see on a personalized level. There are many period type of tracking apps out there. This one specifically is called Clue, but there's many out there. I don't have an affiliation with any of them. But this one, you can link on each day how you're feeling, put in little notes, and can kind of start to see trends over time. Okay, so I put this in really for comedic relief, because as we know, in general in society, this is kind of how society views PMS, right? But I think it's really important to honor the impact of hormones on a person who menstruates, on their life, on their mood, on their physical symptoms, on their behavior. So as much as we joke about PMS and on the negative connotations that are associated with it, there is a significant impact of hormones on women's health. Okay, so speaking of that and thinking about PMS, PMS is a name that is given to a group of symptoms that you may experience up to 14 days before your period. So these symptoms can be include behavioral, psychological, as well as physical symptoms. It is thought that 40 to 80% of women experience PMS symptoms, and this number varies so much in the literature because how PMS is defined, what questions are asked, or how they asked really vary, but it is thought that a large majority of women do experience PMS symptoms. The pathophysiology of PMS is still indefinite. It's complex, it's multifactorial, and it's not really fully understood. It is anticipated to have an influential effects on the progesterone, has on neurotransmitters such as serotonin and the opioids within the body. I took this schematic, which shows the variety of symptoms that some women experience. Generally, not every woman experiences all of the symptoms, but often people will experience different symptoms from each of those headings. So behavioral being the top, psychological, and then physical. So the good news is that exercise can actually help. There is some literature to support that exercise helps with the physical symptoms of PMS. So Denavi et al. Published a study in 2018, and they looked at the effects of 8 weeks of aerobic exercise on the severity of physical symptoms of PMS. So again, this isn't thinking about the emotional or the psychological symptoms, but really focusing on the physical symptoms of PMS. And they did find that there was a significant reduction in the physical symptoms. There was another study done by Vagela et al., and that was in the Journal of Education and Health Promotion in 2019. And what they did here is they looked at both a 1 month bout of regular aerobic exercise as well as yoga, and they found that actually both of those, whether you did the aerobic portion or the yoga, showed a significant reduction in pain intensity and symptoms in PMS. And they actually found overall that the yoga was more beneficial when they did a comparison between groups. They saw a decrease in headaches, nausea, constipation, diarrhea, also saw positive changes in bloating, vomiting, hot flashes, and appetite. So definitely something to consider if you're feeling premenstrual syndrome symptoms, at least from a physical perspective. It can help combat those symptoms. Okay, so menstruation, also known as your period. So the first day of bleeding is day one of your cycle, like I just discussed earlier. Um, An average blood loss in a menstrual cycle is 35 milliliters. And then when we're talking about menorrhagia or heavy menstrual bleeding, this can be defined both subjectively and objectively. So subjectively is defined as the complainant of heavy cyclical menstrual bleeding occurring over several consecutive cycles. And objectively, it's kind of thought of as to be menstrual blood loss of greater than 80 milliliters per month. In the literature, I really found there was a bit of a shift as opposed to focusing on the objective outcome of 80 milliliters with bleeding, and instead of focusing on how the excessive menstrual blood loss really interferes with a woman's social, physical, emotional, or material quality of life, right? So less about the actual milliliters and more about the physical or the patient experience in the impact that it has on her life. So when I was looking at menorrhagia and the impact on quality of life, there was this interesting study that I came across looking at how heavy menstrual bleeding affected quality of life in women. And this was in the Obstetrics and Gynecology Scandinavian Journal. And what they did was they looked at the SF36, which is a quality of life outcome measure that can be used to look at multiple facets of quality of life. And they looked at about 1,500 women, and these were women in the 40 to 45 age range, so kind of in that midlife range. And they chose this age range because these weren't women who they were necessarily having babies or breastfeeding, while certainly some women do in that age group. However, there was less percentage than the younger age group. And what they found, if you see the top line is women with quote unquote normal menstrual bleeding, and the bottom line is women with heavy menstrual bleeding. And on the bottom axis, those are all the subsets of the quality of life. So you're looking at physical functioning, physical role, bodily pain, general health, vitality, social functioning, role emotional, your mental health. So those are all the subsets. And then they bring it into the PCS, which stands for the physical component summary, and then the MCS, which is the mental component summary. So as you can see, across all of the subsets, women were rated their quality of life lower. And in the mental, even more so than the physical. What they found was that women planned events around their bleeding, refrained from activities secondary to their bleeding, and they were absent from work for 1 to 5 days per year, contrasting to the women with normal menstrual bleeding, where they really didn't have any absences from work. So it really showed that there are significant impacts of menorrhagia and heavy menstrual bleeding on quality of life. And certainly I think all people who are in this presentation hopefully are linked with bleeding clinics or a hematologist, but certainly speak and reach out if you need help, because there is assistance out there. So this is a schematic that I pulled from the study that looked at the heavy menstrual bleeding and how it affects quality of life. And what I thought was really interesting here was that the shaded areas you see there where it has bleeded related symptoms and episodic social embarrassment, those are the areas that are typically covered in questionnaires about heavy menstrual bleeding, where the unshaded areas are all the areas that aren't adequately covered by general questions that are asked by healthcare professionals. So there's so much significant planning and preparation that goes into women and preparing for their menstrual periods. So I thought it was important to acknowledge this here, because when we're talking about exercise, and we'll get into exercise and menorrhagia, we need to really understand the effect of just menorrhagia on quality of life before we even think about asking someone or thinking about exercising during that time period when you're having to think about how to go to work and how to plan events around your menstrual bleeding. So, menorrhagia and exercise, is it okay? It is. It is. There's no reason you can't exercise during your period, whether that be normal menstrual like bleeding or if it's a heavy menstrual bleeding. But women do report that they choose not to exercise because they may have difficulty containing their bleeding. Many women choose to avoid exercise that increase pressure in the abdominal cavity, which could potentially create increased flow. So what, there's no, again, literature, there's no research studies to support this, but subjective and focus groups will report that women really avoid jumping and running activities. Many women feel more comfortable doing exercises that don't require frequent change of positions, or that can be done at home, for instance. So really the important thing is that any exercise is okay. However, you really have to find out what works for you and your menstrual bleeding, and what you feel comfortable doing. So it's important to note when we talk about heavy menstrual bleeding, iron deficiency anemia, because certainly this can be a complicating factor that occurs if you have a lot of blood loss that happens on a monthly basis. So iron deficiency anemia occurs when your red blood cells lack adequate healthy red blood cells. Sorry, when your blood lacks healthy red blood cells. So iron is an important part of hemoglobin in red blood cells that carry oxygen around your body. Okay, so hemoglobin is kind of the keeper of oxygen that carries it to your muscles, to your heart, to your body, which obviously you need more of when you're exercising. So bleeding can cause iron to be lost from the body, and if there's heavy bleeding, iron stores in the body can become low, leading to iron deficiency anemia. So some symptoms of iron deficiency anemia can include extreme fatigue, weakness, pale skin, chest pain, fast heartbeat or shortness of breath, headache, dizziness, lightheadedness, cold hands, feet, brittle nails, unusual cravings. So as you can see, quite a few of these symptoms, may make exercise more difficult. If you're extreme fatigue, if you have chest pain, if you're short of breath, it's certainly something to pay attention to. And this is another example of why it's really important to listen to your body and ensure that you are being managed appropriately from anemia perspective. Again, this is where your hematologist or your bleeding disorders clinic can help ensure that you have or are working towards healthy healthy blood iron levels and ensuring you're treated appropriately. So iron deficiency in exercise, is it okay? So at the end of the day, it's not contraindicated. So it's not saying that you can't exercise, but you certainly need to be cautious, right? Oxygen is important and is needed during your workouts. You need more of it when you're working harder, when you're breathing faster, but it's also really vital for energy levels and muscle strength. So iron is responsible for getting oxygen to every part of your body. So low iron can impact your body's ability to get iron to your muscles and organs. It can decrease your endurance and recovery time and increase fatigue and muscle pain. It can also lead to increased lactic acid buildup in your bloodstream. So that's when your muscles might feel really achy and stiff. And since your muscles aren't getting as much iron-rich protein, they won't be able to move as powerfully as they used to. The more exercise you do, interestingly enough, the more iron you need. And that's why doing heavy exercise with anemia can actually worsen your deficiency, add to your symptoms, and require caution. So it's important to make sure that you are getting personalized monitoring for this, ensuring that if you have anemia, it's being treated, and to monitor your symptoms appropriately. When they're looking at female athletes and their iron needs, they find that iron women who exercise at high intensities actually need a lot more iron than women who don't. Iron is lost through sweat, through the skin, through urine, and through the GI tract, and through menstruation. So it is important to be cautious of this. And if you are experiencing symptoms of iron deficiency anemia, to really listen to your body. So what can you do if you have iron deficiency anemia? And what are some tips or tricks and some strategies that you can put into practice? So as I was mentioning, higher intensity exercises require or can increase your iron loss that occurs. So doing more lower intensity workouts are likely smarter. So those including yoga, walking, dancing. If you think back to the beginning of my presentation when I spoke about intensity of exercise, right? That low to moderate intensity, so where you can still have a bit of a conversation or get some words out, would be more where you want to focus your time. And starting with low time frames, 10 to 15 minutes is a great place to start. And I'm saying there that a 15-minute workout is better than no workout at all, for sure. Incorporating more of the generalized kind of physical activity into your daily life. So taking the stairs instead of the elevator, for instance. And these little bits of small activity can really add up over time. depending on your level of anemia, whether it's treated, and depending on your individual symptoms, making sure you're listening to your body. Certainly, if you're ever feeling dizzy or lightheaded, it's best to stop all of your activity. And most of all, take recovery seriously. If you have anemia, your recovery might be slower than others, and you really need to give your body that time to recover that it needs. So at the end of the day, what's important? It's important to listen to your body. So it's okay to rest when you're bleeding if that's what you choose to do when you're on your period, or it's okay to just do less intense activity. It is also okay to continue running and doing more high intensity exercise as long as you feel well enough to do so. Take breaks and exercise when you feel more energetic. And then if you're feeling that you want to be participating in higher intensity exercises but feel limited by potentially leaking or concern for, stains or social embarrassment, thinking about using things like the period underwear or the period shorts, which are becoming really popular, and then obviously the simple ones where it's changing before you start your activity or exercising at home or close to home. So when we really think about, in a summary, about exercising during your period, exercising during different stages of your cycle, the reality is that it's all okay, with some caveats of being careful to listen to your body if you have things like iron deficiency anemia. If we really get down to really looking at the specific times of your cycle, you may find that those first 2 weeks of your cycle are when you're feeling most energetic, clear, and a great time for high intensity training. The second 2 weeks of your cycle, when your estrogen drops, you may feel like choosing slower paced, less intense activities such as yoga or walking. The literature does support PMS and exercise as a way to address the physical symptoms in the very least. And during your period, it is okay to do whatever you want, whether that is high intensity, low intensity. There's no contraindication or reason you can't do any type of exercise. It's what your body is telling you it wants to do. And I think honoring what your body is telling you is really important. Okay, so that's kind of the talk a bit on about your period and talking about exercising on your period. But I think, when we're talking about women's health and we're talking about overall health, I have to kind of have a little bit of a plug in there for your core. And we're going to talk a little bit about pelvic health as we go. So the all important core, and I put this here because when we refer to the core, many people automatically think about your six pack, your abs, doing sit-ups, things like that, where, I want to really focus in on your inner core. So your inner core is some of the most important muscles in your body. And in the schematic, you'll see that on the left-hand side, we have the inner core, the deep stabilizers, and then you have the outer core, which is more of a commonplace understanding of what the core is. I'm going to focus in on the inner core and your deep stabilizers. So the inner core is made up of 4 muscles, the one being your diaphragm, which sits right atop and below your ribs, and this is your breathing muscle. In the front, you have what's called your transversus abdominis. This is your deepest abdominal muscle, and it's kind of like a corset that holds your body and stabilizes your body nice and tightly, and protects you. Your muscles of your pelvic floor, so those are the muscles that sit at the bottom of your body, and then your multifidus, which is one of your deepest lumbar stabilizers and a really important muscle for back pain, especially. So we're going to do a little breathing test together. What I want you to try to do is to put, just like this lovely person in the photo has, I want you to put one hand on your belly and one hand on your chest, okay? And really maybe just close your eyes and take 3 breaths, okay? And while you're doing that, I want you to feel what your hands are doing. So are both hands moving? Is one hand moving? Or no hands moving? I certainly hope you have some hands moving, but really notice and feel what's happening, okay? All right, so hopefully you've all had a chance to do that. Again, one hand kind of up around right under your collarbones, the other one more down by where your ribs come together above your belly button, and really feel what is happening there. Right there. So what should be happening is your hand that's on your belly is the one that should be moving. Okay, so that is the muscle, or that's how we should naturally be breathing, because what that is, and that's incorporating your diaphragm being your breathing muscle. A lot of people, whether it be due to stress, due to posture, due to injury, can have a bit of a shift in their breathing pattern. Now, if you put your hand on your chest below your collarbone, and for those who primarily breathe in this region, if you do that and you breathe kind of just focusing on that, you may feel that it kind of starts to feel a bit stressful and anxiety provoking, because this is really not where we should be primarily breathing. And this is a breathing that is associated with anxiety, with pain, with feeling uncomfortable. So when we breathe there, even at a basic level, that's sending those signals up to our brain of kind of feeling that underlying anxiety and stress at all times. So if you did find that you did tend to breathe primarily up in your chest, I want you to really focus on your belly breathing, and even just putting your hand on your belly and focusing on pushing that out as you breathe. So as you breathe in, you should push out, and then as you breathe out, it comes back in. Okay, you should be feeling that movement in your hand. So that's a way to test, is that if your diaphragm is really firing appropriately. Okay, so we're going to talk a little bit about your pelvic floor now. So these are the muscles that sit on the bottom of your body. They job is basically to support your bowel and bladder, your uterus, and your vagina. Dysfunction occurs when there's the inability to correctly relax and coordinate these muscles. So there can be problems with the pelvic floor for a variety of reasons. I mean, obviously childbirth is a huge one that comes to mind, but it can be things as simple as low back pain or pelvic pain that can cause dysfunction here. And not only are these important for, obviously, for continence and to ensure that you're maintaining support for your pelvic organs, but it's also a really big contributor to back pain or to pelvic pain, because if they're not working properly, your whole core can't work properly. And your core muscles are what stabilize your body. They're not movement muscles, meaning they don't, like your bicep, they don't move your arm up and down. Their job is to fire and to hold your body in place when you're walking upstairs, when you're picking up a box from the floor, etc. So if you have a problem in one part of that chain, you're going to feel a problem somewhere in your body. So we're going to experiment a little bit again, and this is a way to test your pelvic floor reflex. So what I would encourage everyone to do at home is stand up, okay? Put a hand on your lower belly, okay? And I want you to cough. So just try to cough and see what happens. What's happening to your hand? Is it pulling in or is it pulling out? Okay, and give that a try for me. Try a few times. And see what you're feeling. Okay, so again, just putting it kind of lower on your body and coughing or trying to stimulate a cough to see what happens. So what should it do? It should pull in. Okay, so when you cough, your pelvic floor and your transverse abdominis should activate and pull your belly in when we cough, sneeze, and laugh. What that does is it stabilizes our spine during the increase in pressure, activating our pelvic floor to squeeze our urethra, so to prevent leaks, for instance. If this didn't happen, don't worry, there is help for you, and it can be as simple as practicing to cough in. So as mentioned before, if you have dysfunction within your pelvic floor, this can be caused by a variety of reasons. It can be from poor posture, bad breathing pattern. Like I said, if you're really just breathing in through your chest, low back pain, pregnancy, childbirth, it can be fixed. Okay, so the simplest way is just to try to activate that. So when you are going to cough, think about pulling in your belly button towards your spine, and to see if you're able to train yourself with that. If you're having challenges here, certainly it is something you probably want to have addressed, because number one, it could be leading to incontinence, or number two, it could be just incorporating or being a part of potentially back or pelvic dysfunction that you have. Physiotherapy can certainly help with this. Okay, so just when we're talking about core, I think it's really important to get down to the basics of the core and what I mean by that. So I don't want everyone to go out and start doing, really advanced core exercises. As described, some one of the easiest ways that we can address our core health is by belly breathing, right? So doing that diaphragmatic breathing. So simply starting here is a really great point. And putting your hand in your belly and doing those 5 to 10 breaths. The best way to do that is breathing in through your nose and breathing out through your mouth, and trying to do that 2 to 3 times a day. I'd encourage you to try it lying on your back, sitting up, standing up, for instance, or on all fours, to try to really challenge your diaphragm to work in different ways. If we don't challenge our body to work in the way that we use it every day, how are our muscles going to know how to work in different positions that we are in during the day? The second exercise I would encourage is just activating your transverse abdominis. And this can be a bit challenging because, again, it's a stabilizer muscle. So when we think about activating our muscles, we often think about moving our body. If you activate your bicep, you're moving your elbow up and down. But when you're activating your transverse abdominis, you're not actually moving anything, you're just contracting and stabilizing. So this was, I found these specific little videos, or not they're videos, they're like tiny little blips that show, and they had a really nice cue that I liked for activating your TA. So if you're lying on your back, as you'll see in the picture on the top, and you really just think about activating your TA, you take a deep breath in, and then you exhale, making a sound, and you really kind of make it a bit of a gumption. You'll notice that you feel a bit of activation in your belly, and that's actually TA activating. That's transverse abdominis activating. So again, taking a deep breath in and then exhaling and making that sound, you'll feel a corset tightening. This is your TA. So I would practice doing that a few times. And then I would practice doing that in different positions, trying to maintain that activation, perhaps when you are going to move into different positions. And then you can then train your body to activate that before you go to pick up a heavy box or pick up something where your back may be a bit of a disadvantage, and it can really help to stabilize your body. So if you're struggling or unsure, this seems like crazy, you weren't breathing properly, your pelvic floor reflex wasn't there is help out there, okay? So a physiotherapist is a trained healthcare professional that can help you in reaching your physical goals. And there is now a specialized branch of physiotherapy, that's pelvic floor physiotherapy, and that can really help focus in on your pelvic floor muscles and dysfunction that you're having. And not only within just the pelvic floor, being incontinence or urgent incontinence, it can also help with lower back pain, hip pain, or chronic pelvic pain. All of those can be related to dysfunction within your inner core. So I encourage you to reach out if you are having challenges. All right. And that brings us to the end of the presentation. I want to say thank you to everybody for being here and listening with me. And I included this beautiful picture because I am an East Coaster by heart, or that's where I grew up. And this is beautiful Cape Breton Island, where I am from. So if you've never been, you must visit. It is just a very beautiful part of Canada. Thank you very much.